Meanwhile, taking a look at the numbers in Montana, the state reported 360 new cases today. The death toll has risen to 187. Of the more than 14,000 cases, nearly 9,800 have recovered. Well, October began the same way September ended in Montana, with new COVID-19 case numbers topping 300 for multiple days in a row. On September 30th, White House Coronavirus Task Force Response Coordinator Dr. Deborah Birx told MTN that she was concerned about the spread of coronavirus in Montana. Cascade City County Health Officer Tricia Gardner said the rising numbers can be partially attributed to exponential growth of the virus, but also to many people not taking it seriously. Gardner says the recent spike can also be traced back to Labor Day get-togethers and communal outbreaks like the one at the Cascade County Detention Center. Despite that, she doesn't think schools need to make a big adjustment just yet.
The most important thing that we need to remember is a lot of these cases are originating from settings outside of school and work facilities. It's when people are letting down their guard, becoming a little bit more relaxed.
Although health officials haven't designated a specific benchmark for the state to consider another stay-at-home order, Gardner says it's not out of the question. Well, as flu season approaches, the Cascade City County Health Department is also warning of the dangers of overcrowding hospitals. We reported earlier this week that Benefis Health System is currently operating at 115% capacity, with 37 coronavirus patients in intensive care. As the cases rise, some healthcare workers are concerned about the hospital's visitation policies. MTN's Zach Shermley shows us how those policies have evolved throughout the pandemic.
Health officials here at Benefis Health System say they do have enough supplies and capacity to deal with the rising coronavirus cases across the county, that despite the 115% overcapacity number cited at the governor's press conference earlier this week. But Benefis employees have expressed concern with MTN News over the hospital's visitation policies.
It really started to hit Benefis in a big way in March.
Benefis closed to most visitors on March 30th, with few exceptions for the birth center, the NICU, and hospice. It reopened on June 25th with restrictions, and as Chief Medical Officer Dr. Greg Tierney explains.
So we just essentially changed our visitor policy to a managed policy. So it is a limited visitation policy. You can't come in here with 15 or 20 different people.
The new visitor policy has some employees concerned. One of them, who wished to remain anonymous, reached out to MTN News saying there has been no response to staff questions about limiting visitation. They added that guests are often non-compliant with mask ordinances. On masks, Tierney says,
sometimes there are breakdowns, there's no doubt about it.
When it comes to addressing concerns about rising coronavirus cases,
it offers us an opportunity to go back and visit whether we're communicating with our employees and our staff enough.
The other major hospital in town is the Great Falls Clinic, which has almost completely limited visitors with few exceptions since March. But it's important to remember that the clinic and Benefis are very different facilities.
Mainly due to the fact that we're a smaller organization.
The Cascade City County Health Department says deciding on visitation policies is mostly up to the individual facilities.
Every entity does have that right to choose.
Cascade City County Health Department will continue to advise both Benefis and the Great Falls Clinic about visitation policies in Great Falls. I'm Zach Shermley, MTN News.
Both Benefis and the Great Falls Clinic require mask wearing for most patients, staff, and visitors.